Hello everyone, welcome to Nursing Tutors channel. My name is Bruce Kamsime and today we are going to discuss the pharmacology of carbapenems. Carbapenems, they are derived from cinnamycin, which is a derivative of streptomyces, and they end with a suffix penem. And we have examples like imipenem, meropenem, etapenem, and a few new ones which have been discovered of recent. A quick recap on beta-lactams. We said they include carbapenems. Of course, we have others like penicillins, we have cephalosporins, and monobactams. But now we want to exhaust our last branch, which is the carbapenems. And we say that these carbapenems, these beta-lactams, they have a beta-lactam ring, which is their functional group, and this beta-lactam ring can be attached to a series of other side chains which affect their pharmacoproperties. So these carbapenems they are always used in very serious conditions because of their efficacy, because of their resistance to the beta-lactamases. So the mechanism of action of carbapenems, it is not far away from other beta-lactam antibiotics. It inhibits cell wall synthesis, therefore it inhibits the process of transpeptidation, and it works through bindings to the protein binding proteins, and therefore it achieves a bactericidal effect. So it passes through those pores on the outer membranes, and then it can reach the peptidoglycan layer even in the gram-negative bacteria. So these drugs are very important because they are also effective against a very resistant microorganism known as Pseudomonas aeruginosa. So we have already discussed that they bind to protein binding, to penicillin binding proteins, and this is where uh, they are able to achieve the process of stopping transpeptidation. And remember, when we are discussing other beta-lactams, we say that it is through these protein binding, penicillin binding proteins that we can end up having what? Resistance. So we are going to discuss the mechanism of resistance of those drugs. So the mechanism of resistance is almost similar to that one of cephalosporins and that one of penicillins that we discussed in our earlier videos. Remember to subscribe, follow, and turn on your notification. So inside the bacteria cell walls, we have the protein binding, the penicillin binding proteins where these drugs can bind. So sometimes these bacteria mutate and they reduce the membrane permeability. Therefore, the drug cannot enter to reach the protein binding, the penicillin binding proteins. There's increased efflux, of course, and then the other way around is about uh, production of beta-lactamases, much as in this case it is not a common case because we've seen that uh, the carbapenems in this case, for them, they are not more destroyed by the beta-lactamases compared to the other the beta-lactam antibiotics. So this is our Nursing Tutors channel. Subscribe for more videos like this. So let's go ahead. The carbapenems are effective against a wide range of bacteria, including the gram-negative. So they also have extended spectrum against beta-lactamases, and we've said that they are only hydrolyzed by the carbapenemases. So others, it is effective against those beta-lactamases. So the resistance is always low. Therefore, these drugs are always brought out in very serious conditions, and they are only given parentally. Therefore, they are used in patients who are bedridden. However, they are not highly effective in enterobacillus because of reduced permeability, absence of the outer membrane protein destruction by carbapenems, or what we call the beta-lactams, low affinity for protein binding proteins, high efflux, and etc. So these are among all the other microorganisms that we have discussed. Carbapenems are only resistant to enterobacillus. I'm very sorry of the pronunciation of that word, but they are resistant to only those microorganisms. And they have a wide range because they are also effective against methicillin-resistant Staphylococcus aureus. So let's briefly look at the clinical uses of these drugs, which we gave examples like imipenem, meropenem, and ertapenem. So we have said that they are highly effective against gram-positive, that is imipenem, but meropenem has another extended spectrum against gram-negative bacteria, and meropenem is also effective against Pseudomonas aeruginosa. Obstetric and gynecological infections, these are the drugs of choice, can be used in UTI and soft tissue injuries. Imipenem and meropenem, they are used for very serious infections, especially serious infection, polymicrobial infections where you have more than one infections, febrile neutropenia, nosocomial infections caused by Pseudomonas aeruginosa and Actinobacter species. You can employ these drugs to help you. So they have a wide range of they have a wide spectrum against very many microorganisms, and we have seen that for only imipenem is effective against what the gram positive, but meropenem and ertapenem, they are effective against gram negative also. So we have those microorganisms that are able to produce AMP-C beta-lactamases, or that produce those enzymes that inactivate these carbapenems, and they are given by that mnemonic. You can pause this video and read through those beta lactamase producing enzymes. So they have an oral poor absorption. We are now on pharmacokinetics, therefore they can never be given orally. So absorption, imipenem and meropenem are given they start working in 1 hour, and they are given intravenously, and they are widely distributed, and they are able to cross only and only inflamed meninges. They are renally excreted, therefore they are contraindicated, or they may require dose adjustment. So imipenem is a dihydropeptidase 1 substrate. Therefore, if this drug is given, the body will produce dihydropeptidase 1 substrate or enzyme that will inactivate this drug. Therefore, to overcome this problem, this drug must be given with a dihydropeptidase 1 inhibitor, which is cilastatin. Side effects, of course, they are similar to those of other beta-lactam antibiotics, and commonest being allergic reactions where you have rash with carrier, and the immediate one, we may have hypersensitivity. It has cross-sensitivity with penicillins and the cephalosporins. They can, imipenem itself can cause nausea and vomiting, can cause seizures, and etc. So, briefly, we have said that in the kidneys, we produce dihydropeptidase 1 that can affect imipenem. Therefore, we administer it with cilastatin to prevent it from being hydrolyzed by cilastatin. A quick recap of what we looked at. We said that carbapenems, they have a beta